Today we'll be talking about autism spectrum disorders and ADHD. Namaskaram. My name is Junaid Muhammad. I'm working as a psychologist and behavior therapist in Pinnacle Blooms Network. Accompanying me, this is Amrita Raj.
I'm Amrita Raj, behavior therapist in Suchitra 1.
So today we'll be talking about autism spectrum disorders and ADHD and the overlapping phenomenology of ASD and ADHD. So in the beginning, I'll be talking about ADHD and ASD. So first of all, ASD stands for Autism Spectrum Disorder, and it's a neurodevelopmental disorder, as we all know, and the onset is in the childhood. And it is a neurodevelopmental disorder, as I said, and it causes significant impairment. It causes significant impairment in the speech, their social communication, and their social skills as well. And it also comes with sensory symptoms as well, and they'll be showing restricted or repetitive behaviors or interest or activities. So these are the basic characteristics of autism spectrum disorder, and it is considered as a genetical disorder. And the symptoms of ASD usually seen in the early developmental period. Like most of the time, it is prior to 3 years, like from 2 to 3 years of time, they'll be showing the symptoms of ASD. And when it comes to ADHD stands for Attention Deficit Hyperactivity Disorder, and it is like ASD, it is a neurodevelopmental disorder. And when we say neurodevelopmental disorders, there comes two things. One is it is a genetic disorder, and the second thing is a developmental disorder. When we talk about developmental disorder, that means these kind of genetic disorders cause a significant delay in the development of the person or of the infant. And same like ADHD, ADHD will be like ADHD symptoms can be like visible from the early childhood. The onset is in the childhood, and it can be it can be seen before the age of 12, and and it has impairing symptoms of inattention or impulsivity and hyperactivity. So in both the cases, both are like ASD and ADHD are neurodevelopmental disorders, and it is a like developmental disorder as well. So the topic we are talking today about is the overlapping phenomenology between ASD and ADHD and the diagnostic issues. Then later on we will come into the treatment consideration. So first, before starting the topic, we should think about we'll be explaining about why this topic is necessary. ASD is a significant like developmental disorder, and ADHD is also significant disorder, and we have different diagnosis for both of the disorders, different criteria for both of the disorders. Both of the disorders have distinct characteristics as well. But why we talk about the overlapping phenomenology? Because till DSM-5, there was no clinicians were unable to make a differential diagnosis for ADHD and ASD. Initially, ADHD was considered as the secondary, the ADHD symptoms were considered as the secondary symptoms for ASD. So it was very difficult before DSM-5 to diagnose or to identify ADHD and ASD distinctively. So, and like I said, inattention and hyperactivity were considered secondary to ADSD and not due to ADHD. So, when DSM-5 published, we came up with distinctive measures, distinctive diagnostic criteria for ADHD and ASD. Why we need a differential diagnosis for why we need different diagnosis for ASD and ADHD? And people are saying that pretty much symptoms are overlapping. So that is what we are going to discuss today, and that is why the this discussion is much important when it comes to ADHD and ASD. And we'll be going in a general way initially, and like in this time, like ADHD and ASD are growing day by day, and one fourth of the children are affected either by ASD and ADHD. And in a large epidemiological study conducted by British government was suggesting that 30 percentage of the youth are affected by either ADHD or ASD. Studies have been showing the same results as well. And one fourth of the whole children who have ASD has been diagnosed with ADHD. Most of the time, ADHD has been diagnosed initially, and later on, after 1 or 2 years, they will be coming up with ADHD symptoms. So, the clinicians were literally in doubt uh, that most of the time the kid will be showing ASD symptoms initially, then after some times they will be coming up with ADHD symptoms. So is it possible that the ASD and ADHD will overlap? They were thinking about this, and after 2013, when DSM-5 were published and came up with a different diagnosis for ADHD and ASD, studies are going on and researchers have been conducted regarding this. And like and when it comes to the overlapping phenomenology of ADHD and ASD, first of all, we will be talking about the biology. So, the biological causes of ADHD and ASD, how we can how these things will be overlapping when it comes to ASD and ADHD. First of all, it is a shared, and both the things ASD and ADHD share a genetical heritability. These the genes who are causing this developmental disorder are hereditary. It is transferred from generation to generation. So this shared genetic heritability is common in both ASD and ADHD. And the second thing which is common in both ASD and ADHD is impairment in social functioning and executive functioning. When we talk about social functioning, it includes their social skills, peer group relationship, communication with others, and their emotional skills. And when it comes to executive functioning, it includes their memory, their decision making, their problem solving skills, and their inhibitions as well. Inhibitions and what else? Their cognition as well. So, in both the cases, if the kid is diagnosed with ADHD or ASD, both of them, in both the cases, it will be we can see the shared impairment in social functioning and executive functioning. And the third thing is both are neurodevelopmental disorder. That means it is a genetical disorder and it causes significant delay in development. And the fourth thing is and the fourth point is if one dad of twin pair has ADHD, there is a high chance that the other pair will be coming up with ADHD symptoms. These have been has been like proved through studies. And so when we discussed about the biological overlapping phenomenology of ASD and ADHD, and we will be moving on to social functioning. In terms of social functioning, how ADHD and ASD overlaps. When we talk about ASD, the significant characteristics and one of the major diagnostic criteria for ASD is their impairment in social skills and their social functioning. The kids will be having impairment or issues when it comes to their social skills and social communication as well. And when it comes to ADHD, how there is no diagnostic criteria of social skills or social communication in ADHD, but how ADHD kids have this overlapping phenomenology when it comes to social functioning is due to their hyperactivity, due to their impulsivity. These things cause impairment in social function because they are not ready to listen, they are not ready to observe, they are not ready to understand what is happening around them, and they are always impulsive and hyperactive, and they want to do whatever they likes to do. So these things ultimately causes impairment in social functioning. So in both the cases, in ADHD and ASD, we can see that there is a significant impairment in social functioning. And when it comes to social cognition as well, like in ASD kids, lack of or deficits in like social communication affects social perception and social cognition. One of the diagnostic criteria in ASD is lack of social skills. And when it comes to ADHD, this hyperactivity, impulsivity, and lack of social communication leads to a lack of social perception and cognition. This has been proved by studies as well. And the fourth factor is social interaction. When it comes to ADSD, when it comes to ASD, it is crystal clear that the kids will be having impairment in social communication and their social skills. They will be lacking social skills. And when it comes to ADHD, like they might be having the social knowledge, but they'll be having impaired social interaction. And so, in both the cases, in both ASD and ADHD, uh, in both the cases, they will be having significant social impairment and significant impairment in their social interaction as well. And the other factor is their psychological like background. So how ASD and ADHD overlaps when it comes to its psychological background. So when we talk about psychology, we'll be talking about their executive functioning, like inhibition, cognitive functioning, planning, working memory, and concept formation. So and like kids with ADHD will be have more issues with inhibition and planning or problem solving because they are not ready to like think. Because when it comes to problem solving, when it comes to decision making, there should be a thinking process happening before that. Then only they can come up with ample solution for the problem they are facing, or they can come up with a creative idea. So when it comes to ADHD, they have more issues with inhibition and planning or problem solving. But when it comes to ASD kids, they have issues with cognitive flexibility. They prefer to do the things in the same way rather than changing into different methods, or rather than coming out of their comfort zone. So in both cases, in both ADHD and ASD, there are significant impairments in their executive function, whether it is inhibition, whether it is social cognition, whether it is planning, problem solving, or working memory and concept formation. So they are having a significant impairment in both the areas. In both the cases, they have significant impairment. And this executive functioning has been found more impaired in ADHD than ASD. That is a different study, which is suggested by a different study. So now we talked about what is the overlapping phenomenology in terms of biology, in terms of social functioning, in terms of social perception, in terms of social communication, and in terms of their psychological backgrounds. Now we will be moving on to the diagnostic issues. How, why until DSM-5 we didn't had a differential diagnosis for ADHD and ASD. So we'll be talking about that right now. So like after diagnosing ASD, after 2 years, most of the time, on an average, after 2 years, the kids will be diagnosed with ADHD in most of the cases. 1 out of 8 kids are coming out with ADHD symptoms after 2 years of diagnosing with ASD. So why this is happening? The first reason for this is the like presence or absence of specific symptoms are truly like the symptoms like when we do the diagnosis, we will be collecting the information from the parents, from the teachers, or from the caretakers. So the symptoms these teachers, parents, or caretakers are stressing upon maybe related to ADHD than ASD. Sometimes it may be related to ASD than it may be related to ADHD than ASD. So based on the information we are collecting, based on the symptoms, the those who are giving us information were stressing, there is a high chance for a wrong diagnosis. If the person who is giving you the information is stressing upon the ADHD symptoms, we won't be able to find out the ASD symptoms, or we won't be able to give a proper diagnosis. Same thing can happen in ADHD. If they are focusing on ASD symptoms, it won't be possible to give a proper diagnosis regarding ADHD. So that is a difficulty, and it is very difficult when it comes to kids, because they can't talk. They won't be able to provide the proper information. That's why always need an observation time. There must be a rapport building time with the kid, so that the kid will be showing their interest. The kid will be like expressing. We will be able to observe the kid in all the areas, so that we can come up with the proper diagnosis when it comes to ASD and ADHD. And the other thing in ASD is it is a spectrum disorder. When we talk about spectrum disorder, spectrum means the symptoms and the severity varies. It keeps on evolving. It goes up, it goes down. So it is very difficult to diagnose when it comes to ASD. And based on the diagnosis, we will be providing the therapy and the treatments. And the third thing is they both ASD, kids with ASD and ADHD have delay in language. They may be having heightened sensory responses, and they'll be having defiant behaviors, problem with regulating their emotions, difficulty with planning, and inhibiting behaviors. So in both ADHD and ASD, these features are very common. So when it comes to diagnosis of ASD and ADHD, these things play a major role, and it may cause uh, false diagnosis or a wrong diagnosis. And we'll be moving on to treatment consideration. So, how we will be treating ADHD and ASD? In ADHD and ASD as well, the treatment considerations are overlapping in many areas. First of all, we'll be talking about ASD. So, for school age children with ASD, a focus on social, adaptive, and academic skills acquisitions are more important. So when it comes to school age children with ASD, we'll be focusing on their social functioning, their adaptive functioning, and their academic skills acquisition, because that is important. And the other thing is their peer group relationships. Peer group relationships are very important in order to develop social skills, in order to develop social communication, in order to develop the language as well. Because during the childhood, learning happens through observation. It is called vicarious learning. In behavioral school of psychology, learning happening through observation, through reward, and through punishments. So when it comes to learning, by observing how others are doing the things, how things are done by the same age kids. Kids will be learning new things. Kids will be observing in the beginning. Kids will be trying to imitate that, and they'll be putting some logic into that imitation, and they'll be coming up with a habit after that, and they will learn a new behavior. In the end, that is how learning happens in the childhood through observation, and we can call it as vicarious learning. So for this vicarious learning, it is very important for them to get an exposure. They must get an exposure where they can see, where they can observe things, or where they can see the world. That is very much important when it comes to learning. So kids with ASD, we will be focusing on their social functioning, their adaptive functioning, their academic skill, and their academic skill acquisition. When it comes to adults with ASD will be focusing on the development of vocational and adaptive living skills, because there are something called pre-therapeutic skills. So, in order to develop that therapeutic skills, we have to teach them certain things: basic colors, numbers, letters, basic communication, like saying hi and bye and giving a kiss or smiling at people. So these are some pre-therapeutic skills which they need basically. And when it comes to therapy, we will be focusing on their social and adaptive skills if they are children. And if they are adults, we will be focusing on their vocational and adaptive living skills, because that is very important. They have to survive independently, they have to survive in this world without anyone's help. So, for adults, we will be focusing on this adaptive life skills. And when it comes to ADHD, for school age ADHD children, we will be focusing on organizational interventions and parent teacher training and contingency management. Because why we are focusing on this organizational intervention and contingency management? When we talk about contingency, the word itself means that it is a kind of planning for the unpredicted events which may happen in the future. So the kids with ADHD lacks patience, they lacks tolerance, and the significant feature is impulsivity. So it won't be possible for them to sit back, relax, plan for the things happening, or and face the challenge. So when it comes, that's why when it comes to the treatment of ADHD children, we will be more focusing on their organizational interventions and contingency management. And in adults, we will be providing cognitive behavioral therapy. And there are studies which suggest that some pharmacological measures also uh, helpful in ADHD, and ASD, but we are not going to talk about ADHD pharmacological treatments. And most of the professional like practice parameters recommend a combined psychosocial interventions for managing both ADHD and ASD, because that is necessary in terms of their development, for their development and bringing changes. And it is very necessary that we will be providing psychosocial intervention with some pharmacological intervention. So by this we can understand that there is a like overlapping phenomenology in terms of ASD symptoms and ADHD symptoms, and it is necessary that we should be providing a differential diagnosis for all of this ASD and ADHD symptoms. So, if there is any question, I'll be moving to that questions. Okay. The first question is, why do children with autism have difficulty learning in a regular classroom setting? So this is a general question, but there I can talk about some possible reasons for this, um, for having this difficulty learning in a regular class setting. Autism, like I said in the beginning, the major characteristics of autism is they'll be having uh, they lack social skills, and second thing is they'll be having some restricted or repetitive behaviors, and at the same time they'll be having developmental delay. For example, if we are taking a 5-year-old autistic kid, the mental age can be like 2.5, maybe 3. So even if we consider them as a 5-year-old kid, their mental age is of a 3-year-old kid. This is a possibility. I'm giving you an example. So it is not possible for a 3-year-old kid to behave like a 5-year-old kid. In order to behave like a 5-year-old kid, or express or come up with certain abilities like a 5-year-old kid, they should overcome that developmental delay. So when they are going to a classroom, they'll be facing with same age children without having any developmental delay. So it will be a clash. And second thing is most of the time in ASD, like I said, we will be finding some ADHD characteristic. If they are impulsive, if they are having inattention, they won't be able to sit in the same classroom, listen to a single teacher and understand the things without any disturbances. That's why kids with autism have difficulty learning in a regular classroom, sitting with 15 or 20 or 25 kids and from a single teacher. So, and then another question is how to make a hypo kid to hyper kid. So, definitely to reduce this hyperactivity, we need like behavioral interventions. We need hypo kid. Okay, sorry. How to make a hypo kid to hyper kid. So we need behavioral intervention in that. We need occupational interventions in that. We have to use play therapy. We have to develop a confidence in them, and we have to give them physical activities. And if whatever I said till now, we can't generalize these things with every children who are diagnosed with ASD and ADHD, because these are developmental disorders, and and when it comes to ASD especially, that is a spectrum disorder. So we can't say anything for sure until and unless we observe the kid, we came to know about the symptoms, the severity level. So it is not possible for us to generalize things as well. And do we have any other questions? Okay, I think there is no more questions. Anyway, thanks for listening to us, and you can reach out to us through Pinnacle Blooms Network for further inquiries and any helps regarding ADHD and ASD. Thank you so much.
Pinnacle Blooms Network ప్రపంచ వ్యాప్తంగా స్పీచ్ డిలే, ఆటిజం స్పెక్ట్రమ్ డిజార్డర్, కాగ్నిటివ్ డెవలప్మెంటల్, సైకలాజికల్ రుగ్మతలతో బాధపడుతున్న దాదాపు 80 కోట్ల మంది పిల్లలు మరియు పెద్దల జీవిత ప్రమాణాలు మెరుగయ్యే విధంగా దశాబ్దాల రీసెర్చ్ తో కూడినటువంటి అత్యంత ప్రభావవంతమైన స్పీచ్ థెరపీ, ఆక్యుపేషనల్ థెరపీ, బిహేవియరల్ థెరపీ, సైకలాజికల్ కౌన్సిలింగ్, చైల్డ్ డెవలప్మెంట్ మరియు రీహాబిలిటేషన్ సర్వీసులు అందిస్తున్న ఏకైక స్పెషల్ ఎడ్యు హెల్త్ కేర్ సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. ప్రపంచంలోనే మొట్టమొదటిసారిగా మిరాకిల్ అనే పేటెంటెడ్ టెక్నాలజీ సహాయంతో అత్యంత పారదర్శక థెరపీ సర్వీసులను అందిస్తున్న ఏకైక సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. 100 మందికి పైగా నిష్ణాతులైన థెరపిస్టులతో మీ మరియు మీ పిల్లల బంగారు భవిష్యత్తు కొరకు పాటుపడుతున్న సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. భారత ప్రభుత్వ ప్రతిష్టాత్మక స్టార్టప్ ఇండియా అవార్డు పొందిన భారత్ హెల్త్ కేర్ ప్రైవేట్ లిమిటెడ్ యొక్క అనుబంధ సంస్థ.